Yay.
Hi, everybody. Welcome back to Heal Yourself Naturally. I am Nicole. I'm here with Sarah and Hava. Another amazing class or podcast for you today, and we're talking about all about our wonderful organ, the heart, the thing that keeps us going and giving flow to the river of life. So we're going to learn today about how to keep your heart healthy, how to keep your body healthy in order to support your heart, et cetera, et cetera. So let's go straight into it. Let's talk about our wonderful organ, the heart. Sarah, I want you well, we can talk about many diseases like that you can heart diseases that one can have, but let's just pick the most common one that you know that you've seen in your clients.
Well, that would have to be just people with what we call high cholesterol and
Right.
being put on a statin. I think that is probably something that we should drill down in today, just because, it wasn't long ago where the medical cartel had decided that everybody over 45 had to be on a statin. And, we had to get everyone's cholesterol down below 200 because, that's the magic number. Because if you're over 200, you might die of a heart attack. And I just feel like that kind of reductionist and linear thinking does such a disservice to people. So I would say, you know, helping people with that whole issue is what I have the most experience with. Um, and I also have experience with just typical heart palpitations and why people get those, what the source is. So it could be a lot of different reasons, but focusing on the high cholesterol myth, I'll just talk about that for a second. So
Yeah,
read
I'd love that
about,
because that's the biggest issue that we
right.
see nowadays. People on cholesterol medication.
Yeah, and they're giving out like candy. And and even I have a cholesterol of like 235 and and I'm high and they're just like, "Well, you got to get that down." It's like, "All right, so this is the skinny." There are risk factors that many people have that contribute to cholesterol being too high in the blood. And it's not just cholesterol, it's a certain type of lipid. And they're fats that float around in the blood. We have LDL, which many people probably understand, HDL, and triglycerides that are the typical ones that the doctor will test for. The LDL is considered the bad cholesterol. The HDL is the good cholesterol. And
Right.
it's a good cholesterol because it takes up the LDL from the blood. It gathers it up. So the little HDL is going through the bloodstream, it sees the LDL and it grabs it up. And the reason why it sees it and grabs it up is because the LDL had already done its job. LDL goes through the bloodstream and it carries nutrients in its little boat and it brings it to every one of the cells in your body. So LDL is not a bad cholesterol. It's actually very good because it gives you nutrients that you need. And the HDL is absolutely something that notices the LDL has done its job and it grabs it up and it brings it back to the liver and it gets recycled and it can go back out into the bloodstream and do its job. Triglycerides are something that is a type of lipid that is mostly made of fructose that the liver gives off in response to too much sugar in the blood. So the liver will send off these markers, grab up all this fructose and store it as triglycerides. And so that's where we get fatty liver. Now, high triglycerides are associated with too much sugar in your life. It's associated with type 2 diabetes. And so if you have a high triglyceride, you probably either have blood sugar problems or you're eating too much sugar. Um, when we talk about LDL being bad, there are several types of LDL. And the one that's the worst is the oxidized LDL. So if your doctor says, well, you have high LDL, we need to get that down, you say, well, what type of LDL are we talking about? And the doctor might say, what do you mean? Now, there's plenty of doctors that understand the differences between the types of LDL. We want to know what the oxidized LDL is because that's the unstable, that's the fat that can cause problems. That's the fat that your immune system grabs, your macrophages grab and shove it into the vessel walls, and that's what causes the plaque buildup. So we want to keep oxidized LDL at a minimum. And most people who have high LDL, for one thing, they don't even know what oxidized values are there in proportion because they're not testing for it. And secondly, you can have high LDL or high cholesterol in your blood vessels, and it's not a problem. If you don't have high inflammation markers, if you don't have high blood sugar insulin problems, and if you don't have high triglycerides, if you're not a smoker, drink too much alcohol, and have too much stress, and have thyroid problems, you're probably not at a risk factor for heart attacks or strokes. But we have to look at all the underlying risk factors that may be present in order to really assess your whole risk, for heart disease or heart attack, I should say, coronary heart disease. So that's
Well,
kind of the skinny. There's a lot more to it, and if anyone's interested in the diagnostics, that's a whole other ball game. We're not going to get down that. We're not going to drill down that far. But to say someone has high cholesterol and they need to go on drugs is linear, reductionist, and it's insane. Statins have a myriad of issues. Side effects are very often never even known, and it can be things like neuropathies, memory problems, things like that. So statins stop this whole pathway in the liver that takes squalene and creates all these cholesterol um, forms of cholesterol in our bodies that we need to make neurotransmitters, to make CoQ10. It goes on to help with glutathione in the body. I mean, we're stopping a process that's vital for life, and they are not associated with a reduced risk of heart disease.
right. So first of all, I want to commend you. You called it the skinny, but for me in my head, when you were talking with your hands, and I felt like I'm in the Magic Yellow School Bus episode, and I travel down into the body. Did you not? Did everybody not feel that? I did. Anyways, I used to love that show as a child, just because like even when I talk to clients or people or whatever, and they're describing things, I'm like, I'm traveling down in your body and I'm seeing it. And that's, we have to look at our body like that. We have to see it and break it down into different things, even though there's a whole bigger picture, but it's broken down into different pieces. Now, all of what you said was very informative. So someone who does have high cholesterol, right? In standards of like the oxidized kind, right?
Yep.
What kind of herbs can we suggest in order to help with that? Obviously, lifestyle changes in terms of diet are highly recommended. What are some herbs that you would suggest?
Me? So hawthorn is the first and foremost. A
Right.
hawthorn leaf and
I just
flower.
got it. I bought it for the class.
We
I
have some
said we
visual
have to
aids for the
show them,
people.
right? We have to show and tell.
So hawthorn is a tree,
This is how
and we
he
use
looks
the
like.
berry. Yeah, there's the berry. And we also use the leaf and the flower, and I like to combine them. So that's an excellent circulatory tonic. It's an anti-inflammatory for the vasculature, for the arteries, for the heart too. It's a strengthener of the heart. I use it for high cholesterol, hypertension, anything to do with the heart, even varicosities, varicose veins, things like that. My
Right.
my other herbs I like to use, I have a formulation I use it's called cholesterol cutter, and it works really well. And it has amla, which is a fruit, so antioxidants, anti-inflammatories. It has linden flower, which is known to melt plaque. It helps with hypertension, and it also just is wonderful heart tonic, circulatory tonic. Resveratrol, which is not a plant, but an extract from a plant, usually either grape skins or Japanese knotweed it's extracted from, and that is also an anti-inflammatory. It has another one in there, and now I forgot what was in there. Crap. What's the next one?
But hawthorn is included in that blend?
And hawthorn. Did I not say hawthorn?
We talked about hawthorn being your
Hawthorn's in
favorite, but
there
then you
too.
said you had a blend that you like.
Yep,
And
hawthorn's in there too. Because there's four, and hawthorn was the fourth.
see, I thought so. I was just directing
Hello.
you there.
Kira.
Yeah. Hello.
Hello, come back.
Um,
So that's, and I have it in a powder. People, you can encapsulate it. You can put it in a smoothie. And I have people who have been using it for like a year and a half, and their cholesterol numbers went down. And I would say that when I'm giving it to people, it's because they are in that risk factor. We can see that they have inflammation. We can see they have calcifications around the heart. We want to start addressing that inflammation. So that is
right.
my go-to. That formulation is awesome. Awesome.
Love all that explanation.
And I
Okay.
have other ones too, but I want to.
No, we're gonna get on to other types of symptoms. And diseases or diseases, as Sarah likes to call it, that have to do with heart health. But let's, we'll try to cover as much as we can. There's a lot. So, Chava, what's your most common? What do you see commonly with your clients that also has to do with heart health?
Well, it's obviously similar to the SARA, because that's the main issue where the most
Right.
people go to their health checkups, and then they get a prescription from the doctors, and in the most cases it's absolutely harmful. And the problem is that people are always forgetting that the body is a self-healing machine. Every single
Right.
time, everything that we see on this that surface, or everything that we see that comes to the either from simple diseases to complicated ones, starts from somewhere. And the problem is that we are not aware, and we look at the symptoms as a curse, and then we're trying to cover up right away, when in reality that's not what the body is asking from us. When the body is telling you, oh, you have a high cholesterol, it just tells you, love me, take care of me more, or give me some diet, or do some change. And the problem that we are dealing is that people are not doing that, but they right away covering on the problem, actually more exaggerating the problem by giving a quick fixes. And
Right.
then we end up actually more people dying from heart attacks. Why? Because they are taking all those medications that basically they don't do shit. And that's the whole problem is here, that I want people to learn to stop being in this fear mode. And it's so sad that that the way we build this around, we build our life around the doctor's office. That's how I see it. Like most people, what they do is they basically, all their life is around the doctor's appointments. All what they do is looking for a trouble. It's like you waiting to be in trouble. It's like you inviting yourself, oh, every few months let's do a blood checkups. And oh, every year we have to do this checkup, and this is such a big problem, that we are no longer really feeling our body. We become like those machines who no longer connected to their own bodies, and this is where the trouble starts. And the heart and is just it's just another way of complicated things that are uncomplicated.
Yeah,
so
it's like
so
it's continuing to put a bandage on an infected wound. You have to actually
and
treat
this
it.
is, and see, the problem is that because we surround ourselves with the doctors and we're no longer listening to those first symptoms that the body sends us, then and we actually causing more damage. So the idea of this podcast is to tell you that you don't need to do this. You first have to listen to your inner voice. You have to, and I always say, cut the bullshit. You know exactly the truth. You know why you have a problem. You know why you have the stress. You know why you have, you just go to the doctor. And the fun part is that actually doctor is 80% should be psychologist, and only 10% should be a doctor. And that's what people, 80 or 90, whatever I said,
You
doesn't
said
matter.
80 first, but we all got it.
80%, but
Yeah.
20% a doctor. See why? Is because why we need this feeling, because we are not sure in ourselves. We don't know, so we go to the doctor, and because we want to hear someone listen to us, someone give us a hug, someone give us a love, or just listen to the problem that we, and but unfortunately when you end up in the doctor, you end up with prescription, and then you
And
actually
only
try.
about 5 minutes of listening at best. And
Right. And then
typically they're cutting you off and making you feel incompetent in your own feelings or whatever you're going through. But
right.
all that aside, okay, so one of the things that goes hand in hand with cholesterol medication is also a blood thinner, right? Because
Right.
they
But that's
say you have
all
high
connected.
cholesterol. You also need to go on an aspirin, just God forbid, so that you don't have a heart attack. Okay, we all know that we don't need to go on an aspirin. There are things that can thin your blood naturally. Chava, I know you have a favorite. What is your
Right.
favorite?
Right. But I mean, I know that, how I tell you that it's like, yes, there is a herbs that we can give, and that's but I want first people to understand what I'm trying to pass here, that it's
I
very
think we got it.
crucial,
Yeah.
because if we don't understand the first step, the next step is just useless. So the first step is no fear, and the next step when comes is to really asking yourself why and what I have. Like I've just had recently, one mom, she's 45 years old and she never was pregnant before, and suddenly she is pregnant, and so much happiness in the life, and the doctor prescribed her on the blood thinners. For God's sake, why? Oh, just in case when you will go into delivery, then you might, blah, blah, blah. So we have to thin your blood. Then I have someone last a couple
So
weeks
she can
ago
risk
who,
hemorrhaging more? I
yeah,
don't
so
get it.
someone who broke his leg, and the doctor put him on the blood thinners. Why? Because it helps with inflammation, and it might help you to prevent, like, what? Like, this is so important. These questions are so important before we even jumping into, here, take some garlic, here, take some turmeric, or here, take some hawthornberries. You need to understand the first thing, why I need this. Why? Right? That's like so important, because if we don't ask the questions, we're just doing the same thing over and over. So once you figure out, the doctor tells you, okay, you broke your bones and we will put you on a blood thinner. The question is why, okay? And then the answer comes into the picture. And the answer can be, first of all, clean your diet and drink more water. That's number one blood thinner right there. And most people are dehydrated. Most people don't drink enough, even though they tell us, yeah, we drink. Yes, if you drink a good amount of water, but then you're chugging so much caffeine, or you chugging so much, let's say, other stuff, like could be like alcohol, right? Or you're smoking, or you're in trouble. So you have to drink more. You have to hydrate your body, so that way you will feel more, more, your cells will be more hydrated, and automatically your blood will get more thin. Next things to do when you're in a fear, what is the problem? We don't breathe. We no longer take oxygen in, but the heart needs oxygen, because that's what it sends blood toward, right? So if we don't, the fear causing us not to breathe, that's a big problem. So we have to breathe more. So learn how to, every morning, wake up, You straighten up your shoulders and start breathing. And sometimes I even catch myself. I say, Hava, did you breathe today? Like, I don't remember, because the life is so hectic. You like running from right there. So you don't really feel, that yes, you do have to breathe. So stop and breathe. It will also will help to thin your arteries as well, will send a good blood flow toward your heart, right? So drinking, obviously, then breathing, deep breathing, and there is so many valuable exercise you can just look up on YouTube, right? Next thing is a clean diet, right? And a clean diet is a good, and the best source will be wholesome food, garlic, cayenne, right? And they're absolutely incredible. Garlic is a blood cleanser, so it's wonderful to have at all times. I would always suggest to have eat some few pieces of garlic every single day, because the garlic will help to remove plaque from our heart, right? And then what other things that I usually
But
suggest?
don't
Oh, the
just
ginger.
chew a whole head of clove of garlic. Okay, I've made that mistake of just sticking it in my mouth.
Yes, so
If
that
we're gonna
that
tell
we
people
don't
to
do.
eat
So that's
garlic.
another thing that I always say: never chew on garlic straight up, because it
Yeah.
will irritate your
Woo.
lining of your stomach. So you mix it with some honey,
Honey,
or I
yeah.
usually suggest, right, Sarah, is the soups. You prepare a delicious soup, and then you just crush some fresh garlic, and it's
Yeah,
wonderful this way, and it will go in and will soothe your stomach and will fight whatever the problem is in there. I mean, there is so many wonderful things that I would suggest. Like, and another one valuable thing is good minerals, and that's what we are lacking. Because
Right.
our food is so rich in simple carbohydrates, in the sugar, like Sarah mentioned before, right? Sugar is the enemy, but the strawberries are not, the blueberries are not, the vegetables, carrots, and they're not our enemies, and we are not consuming them enough. So that's why we having a
that's right.
problem. So once you get rid of the sugar, you'll see
Of the
um,
processed sugar, right? Yeah.
the processed sugar, exactly. Don't
Yeah.
make mistake when we speak about good sugars. We're talking about fruits. You can have a whole watermelon, you can have a whole basket of strawberries, nothing happened. Your body will just thank you, will do what it's designed to do. Like, I always look up back and my grandmother, and her health, because that's where I grew up, and I always try to compare to what is happening right now. And if my grandma would live at this time, she would probably will be heavily medicated. She would be, because she was a little bit overweight, and she would, and and probably she would die from heart attack. And listen, she didn't. And she knew how to take care of herself, and she knew when she was listening to some news, she would just take some valerian, and she would calm her heart. The
Nerves.
old
Yeah.
people who come from Russia, they know valerian because that was the main medicine at that time. Oh, I just heard some news, can you give me some valerian? That was like a part. I don't know why, but people knew how to take care of themselves and live till 100. And we have all this, what we have, all these doctors, and we better survive till
Right.
60s.
Which keep us living quote unquote longer, but what kind of life? It's not a wholesome life. It's not someone who lived to 100, you know,
And I'd
years.
argue too, like there's many cultures that have had. I mean, we always say, well, we used to not live as long, and we live longer now. And I just argue that point. I said, yeah, a lot more
Depends
people
on where.
died.
Yeah.
Right. A lot more people died younger, but it wasn't just because of ill health. It was because of accidents. It was because of wars. It was because of a lot of different things. But there's
Right.
plenty of people back in the day that lived to be 70, 80, or 90 years old, you
I
know?
agree. And
And
most
a lot
people who
more
live,
people now dying young of heart attacks and
Right.
heart disease.
Right.
So, it,
Right.
Yes.
Yeah.
I
So,
also want to talk about you mentioned like calcification in the arteries, right? So there's things that can help reduce and remove that. We have talked previously about good water sources. Kava did mention steam distilled water gets rid of calcification in the bones. Is that something also, Kava, that can help get rid of calcification in the
not
arteries?
and it's no, not in the bone. That's a calcification that when you drink, it removes toxic matter, which is a build up. So yes,
So
it's
it can help.
100%.
It can also help with that. Okay, but what are
Yeah.
some herbs that can help with that?
Well,
Are there herbs?
for calcification,
as
Yeah.
we as for calcification, yeah. I mean,
all the
obviously,
things we've mentioned. I think that
Okay.
the main thing is like getting enough antioxidants in your body to,
yes,
Right.
because the underlying issue with heart disease, whether we're talking, hypertension can be caused by this, but the hypertension, there's a lot of other pieces to that. But when you're talking just like the base, it's inflammation. It's like what causes inflammation in the
Bad
artery,
food. Yeah.
right? It's stress, it's hydrogenated oils, it's high fructose corn syrup, in too much sugar in your body, it's smoking, it's alcohol. It's basically those five things. And oh, six, and thyroid health. I mean, thyroid health, most people are deficient in iodine. So thyroid
Right.
health
We've
is huge.
spoken
So if
about
you
this.
cover all those things, you reduce your risk of heart disease precipitously. I mean, and you don't need a statin for any of that.
Right.
And Hava was talking about all the ways, is a baseline as well to stay healthy and keep your heart healthy. And what happens with this whole blood thinner thing and why people have sticky blood is mostly because of sugar issues. So those are your type 2 diabetics. But it's inflammation. So you got to feed your body what it needs. And, there's a lot of additives, preservatives, things like that can create a lot of inflammation as well. So eat clean and address those six things. You can address those six things. You can keep your heart healthy. I mean,
Right.
that's just the
And a lot of
bare
other
bones.
things healthy. Let's be real.
Obviously.
Because it always comes back to these things that we've talked about.
This
Also,
call will be recorded.
like what was that?
Let's
I
mute
don't know
everybody,
what
please.
happened.
We've got people on, but
This
we,
call
we
is
need
no
him to
longer being
mute.
recorded.
Please mute.
Yeah, please mute yourself.
I wish I thought I could mute everybody, but
You could, but that person just got sent off. But it's like, anywho. So, what I was trying to say is that we've gone back on it. Kava mentioned it briefly when she was talking about, okay, wake up, see why is this happening to me? Like, ask the question first. And a lot of it has to do with gut health again, people, because if you're not processing your food, if you're not eliminating the garbage that you're putting into your body, it then trickles and leads itself into your bloodstream, which then goes to the heart. So the heart has to deal with it because your gut couldn't deal with it. And that's, it also always goes down to the gut, which we've mentioned so many times on our previous shows and podcasts, that gut health is super important. It's okay to obsess a little bit about your poop. My kids hate it at this point because we talk about it so much,
I know.
but it's okay to care about it because
Absolutely.
that's what's going to keep us healthy. And if we're putting good things in our body and we are releasing bowel movements properly, then we can be sure that our cholesterol won't be, we won't be in harm because of, like you said, you're at the 220 right now, but it's what was it?
LDL.
LDL. What types of LDL, like what type is it? And a lot of doctors will just look at you and say, huh? Right? And with a lot of things that you mentioned that you've researched yourself, or even if you've heard it here and then mention it to your doctor, they'll look at you like you're pretty crazy.
Yeah.
But a
Oh,
lot of
they'll
the
say,
healing process.
Right. They'll say
I'm
like,
not
"Oh, there's no
sure.
code for that. There's no code for
Yeah,
that."
but you should just go on this or blah 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 blah. I can't support your theories because I'm not sure. I haven't learned about it, but this is the prescription. And a huge part of healing, whether or not you use a doctor's care, a traditional doctor now, Western medicine, or you incorporate Eastern medicine or naturopathy, right? Things that we're talking about, like herbs and whatnot. Or if you just use one or the other, right? Either combined or one or the other. The big key in the healing process is trusting your intuition, right? Because if we are taking an herb like hawthorn and it's making us feel awesome and we feel the difference, then we can continue, even though we have the prescription waiting to be filled, we can continue taking hawthorn for a good amount of time because we feel the difference in our body, right? And then you can always go for a recheck. But the point is trusting your gut and your intuition. That's what Kava likes to call your inner voice, listening to your inner voice. We're intuitive. We're human beings. We're intuitive. We should just listen to our intuition most of the time, and we wouldn't be in these problems. Should I have another glass of wine? Probably not. But hey, screw it. I'm gonna have it. Well, you should listen to your intuition because it's gonna add up. Um, anyways, oh, we have doggies. We have lines that are going dead. We just have a lot of chaos today on Heal Yourself Naturally.
Yeah,
But
also,
We can handle it.
I would like to add something, and that
yeah,
many times you hear people tell you, but like my heart suggests, right? Because we need to understand the heart is not also a very important organ in the body, but the heart also is the one that's suggesting things for you to do or accomplish or send messages to your brain. Because and this is where the knowledge is so necessary, so that way you'll know to sift when is the heart is suggesting good things and when the heart is suggesting a bad thing. And I would say that the in, I would sometimes I'm trying to see where exactly this intuition fits into the picture, because many people think what we're thinking from our heart. And like there is this guy who speaks how not to die, and he always would mention that, and he always, my heart suggested that I should drink and eat this crappy food. And then when I learned to cut my brain from my heart and I only work with my brain, then I feel that I create change in my life. He kind of puts a blame on the heart or on the thoughts. It's like
yeah. But intuition is a feeling. It's not necessarily a heart's choice, right? It's a certain
Oh,
energy that you
well,
feel,
I have
right?
something to say about that. As a psychic medium, um, I absolutely get into my heart center in order for me to see intuitively.
I wanted to hear about Reiki point of view, but yeah,
Yeah, I mean, I guess this is a good time to interject on that. I
right.
feel
Let's
like,
hear.
if I'm up here all the time, if I'm like, oh, if you have a LDL oxidized, you have high fibrinogen, and I'm like so clinically and taking it apart and analyzing it, it's like, okay, I have to get out of this headspace and get back into my heart space, and I just can see, all right, what does this person actually need? This person who's dealing with heart issues is dealing with loss, dealing with how you love yourself and how you allow love into your life and how you love others. Do you feel like you deserve love? Usually that's not the case. Usually people who have heart issues are feeling at some point in time they don't either deserve love, or there's something to do with a loss of a loved one, you've been rejected, abandonment lives in the heart. All these emotions live in the heart. But but the foundation is how we allow love in and how we allow love out and how we love ourselves. And so these are the questions we're going to be asking as well. And I do find that most of the time it's the men that have the heart problems, and they really have a hard time talking about love and how they allow love in. And there you go. There's the imbalance, right? Um,
Right.
and
But
that's pretty
even though
simple.
Sarah, I'm sorry, but even though that the females are also more, even though males they have more problems with cholesterol and whatever, that the females are the ones whose heart is usually giving up first.
Sure.
No, it's not what we see from studies that female by the end they're the ones who many females die from heart problems more
Yeah,
than
but
men. I don't know.
predominantly men are dying more of heart problems than,
Yeah,
I
I
mean,
thought that
Yeah,
actually.
statistically.
men are dying statistically more from heart disease or heart attacks than women. I think it's a fair share. I don't-
I think women are coming
honestly,
up. I think
but
women.
honestly, I cannot. Yeah, I think women's numbers are shooting up. You're absolutely right. I cannot, for the life of me, if I look and like, I try to sort from all the, older adults in my life or people that I know, almost every single one of them, male or female, are on cholesterol medication
Yeah,
because it's been suggested by the
yeah,
doctor,
because they're
which
all about them.
leads to more heart problems. And it's not going to, like you said, it will not stop the heart attack. It will not stop the issue from coming.
No,
It
and I
might
can,
give you a little bit more time.
and I have
Yeah, go
I
ahead,
have a
Sarah.
case study. I have a couple of people that I can point out. Um, One gentleman
Right.
came to me just on Saturday, and he had a stroke. And his heart, I don't think he had a heart attack, but he had a stroke, which is all kind of related. He's got blood sugar problems, he's insulin resistant.
Right.
They put him on a statin. He's been on a blood thinner because he has AFib. He's been on a blood thinner for as long as I've known him. And it still didn't stop the
Mm,
blockage. He still was spitting off clots. So obviously the blood thinner wasn't doing its job. And then they put him on a statin, which a high dose statin, which lowered his LDL, he lowered his lipids in his blood very, they're very low now, which isn't good. But he was on a blood thinner, and
right.
he still was spitting out clots. So it's like, they do all this stuff. It's not perfect. They're doing what they can. But in reality, when we look at the statistics, as far as a statin is concerned, there are studies out there that show you basically your absolute risk reduction by going on a statin is like you might be reducing your risk by like 1% or something. I mean, it's not 2 or 3%. I mean,
Right.
it's it's not even worth
It's
the
not
issue that it
significant
becomes,
enough to even, it's not worth it, right?
because they're
Because
not
like you
getting,
said, a lot of the side effects are unknown or they arise regardless. And so do you want to add on to your heart disease by having memory loss or
right,
fatigue or right? So
or heart
people
issues. And then
there's
with with the same with the same person, they went back, and because the wife is very knowledgeable, and she was like, "Well, do you think he should go on CoQ10 if you're putting him on the statin?" And the doctor was like, "What's CoQ10?" And I was like, what is happening right now in the world? How does a cardiologist know what freaking CoQ10 is when you're going to stop CoQ10 from being produced in the body? They call it ubiquinone for a reason because it's ubiquitous in the body. All your cells need CoQ10, and statins stop that process. So that's why people get extremity weakness and pain. That's all CoQ10. And it's actually very important for heart health. So it's like,
so it's counterintuitive, the medication, really. They
yeah.
honestly, it's all it's all part of a big pharma plan, and doctors are taught to prescribe things because at the end of the day they get checks written for prescribing certain things.
Sure.
So yeah, there is no lesser evil when it comes to, do I
Let's
take it or do
continue
I
into
not?
the solutions. Let's go get
Well,
into
we
the
can
Yeah,
also,
we
solutions.
did talk about some
More,
herbs.
more,
We talked
more.
about
Let's
lifestyle changes. Okay, Chava, please give us more. Give us more. Give me more.
we should
now
also
I
talk
feel
about
I feel
hypertension too, guys, because we didn't, that's really,
Yeah, and AFib. Right, right. Okay, Chava, talk
But
to us about
let's.
hypertension.
I want to really people give the solutions. Instead, we give overly. Let's give more solutions. I feel that people need to know. Even simple things like a cayenne. I usually always say in my classes, you should always keep cayenne at all times in every place in your um, in your car, in your living room, in anywhere. Basically, should always will be handy because that can save someone's life, right? So I do want to. I think it's never enough to speak about the cayenne because the cayenne is absolute circulatory medicine, and it will help to bring back a dead person. So if you are somewhere where you see the person is losing it and might having a heart attack, you give about a half teaspoon in a quarter cup of a hot water, and you just chug it down, and you'll see the person will. You give the person to drink, and as long you see the person can drink, and it will save someone's life. So that's something handy. I want everyone always have it on hand. I have in my
Right,
pocket
and you
in my
do suggest having a tincture because it's more easily
right.
consumed,
You
you
can
know?
have a in a powder. You can make your own tincture. Hopefully we'll show more, and Sarah shows and I show how to prepare a tincture. It needs to be always available, and so many times the cayenne saved people lives, and not only people's but animals as well. So that's why cayenne is number one remedy. And if you want to have a healthy heart, instead, thinking too much, every single day put a little bit pinch of a cayenne on your in your liquid and drink it in your tea or in water with lemon by the morning, and you'll see how you suddenly will get this flash of energy, right? So the cayenne is incredible. And yeah, so that's about the cayenne, and it's very important. And also, if you feel a little bit dizzy, if you feel that something is not okay, just a pinch of even the pinch, one drop of a cayenne or a little bit cayenne on the tongue will bring you back to life. So that's very important. This is a very important tool. The next thing I
Is it
want to
helpful in
suggest,
hypertension?
it's always help in everything. And if the person is it is cayenne will well, because even if you throw have and you are rushing, you want to calm things down, but still you want to send blood toward the area. So I would say cayenne is number one for everything. It doesn't matter for what. Number one, cayenne is, it's like, I would say, is if the only herb you can take with you, that should be cayenne. Okay, that's how I really want to idolize this this herb. Okay, even you
Right,
might
because
say
it
it's
can
crazy, there's
reduce
so many other ones.
the probability of hypertension in the body.
Anything, because we need
Yeah,
the blood flow. We need the blood flow toward the head. We need the blood flow toward our heart. We need blood
right.
flow toward our stomach. So
Which
that's
we've
all
talked
about
about. I
blood.
see you have your clapper, and we've
Okay, so
talked
the
about
next
bringing
thing I
circulation
suggest
before.
people is I suggest to people to learn how to use a clapper. A clapper is absolutely incredible because clapper will help you to create circulation. And actually, there was a viral video that went in China that someone went into heart attack while he was watching a movie in a theater, and many people just jump on and start clapping on those areas. This is a meridians that are closer connected to the heart, and as more they clap, the person actually become more alive. So basically, you can save someone's life by knowing that by clapping you can create circulation. So clapping is very important, and what the clapping that brings blood. Okay, well, that's what we want. We want to see. I
Blood flow,
myself
right?
suffer. Yes, let's say I have a problem. It's not nice to say, but everyone, we all suffer. That's why we're in this world of healing, to help ourselves. Let's say I have anemia issues, right? And I've been dealing this for many, many, many years. And I do know, if I don't walk, if I don't exercise, if I don't use hot and cold therapy, if I don't scrub myself, then I have a breathing problem. Then I have, my heart is not working well. Why? Because it's lacking the main important component, which is oxygen. That's why I'm putting so much into understanding oxygen brings life to you, right? That's why clapping, just by clapping over the area, you feel action, you feel movement. That's so important, right? And the next thing I always suggest,
Stimulation, yeah.
yeah, and another thing I always suggest to people to have on hand is knowing a hydrotherapy, which is a treatment of a hot and cold. So let's say if someone is having a problem, instead being in fear, you put some cayenne and then just apply hot and cold over the area. You will stimulate that area, and our heart is absolutely loves hot and cold, and that's why the bath of the hot and cold and showers are so important. So I really want to tell people that you have so much available just on tip of your hands, and you can help so much instead just rushing and giving these statins and
Right.
whatever the hell the
Just
doctors
like
give you.
this new trend of cold plunges after exercising, or just random cold plunges. But I know that there's an importance of heating the body, or doing some grueling exercise before the cold plunge. That's important, and it's something people forget. You can't just plunge into cold water out of nowhere. I
Exactly.
mean, you can, but the benefits of going from hot to cold are, it's more beneficial. Um,
So
Sarah, do you have
that
any
I
more
really
suggestions for
wanted to mention that.
No, I love that. Yeah. Do you have any more suggestions for hypertension?
Yeah, that's another problem that I see a lot. A lot of people have hypertension. And of course, there's a lot of underlying issues that can occur and to cause that. And you'll actually, if you look it up, they'll say, we really don't know. But we do know. It's stress is like huge. Stress can kind of screw with the adrenal glands, and if you're pumping out too much of something and not enough of something else, then you could get hypertension. It's basically relegated to the kidneys or the heart, and somewhat in the brain. So I'm usually asking a series of questions, and many time, and it's always inflammation is at the core of it. So there's some
Right.
inflammation going on. Usually it's someone who's got some anger, there's some anger bottled up in there, or there's fear, but it's usually anger that I see. So my favorite herbs for hypertension, number one is hawthorn. Um, Number two is mistletoe. And mistletoe is a plant that you have to be careful of. So, because it's a pretty powerful plant. So I'm usually using it in a small part in a blend. Yeah. Linden is one of my favorites. It's calming, and it's a wonderful heart plant. I use Rowalfia, and
Oh, wow.
Rowalfia is, yeah, and that one is, it's spelled, I mean, I can spell it, or if anybody is interested. You could probably phonetically spell it and still it'll come up on
Right. Rural welfare. Yeah.
Rowalfia. And that one's pretty powerful. So you really have to be careful how much you use of that one. Um, what else do I use? I use other herbs that are calming, like to the nervous system, because the nervous system and hypertension are typically associated. So it's not just endocrine, which is stress. And so I like lemon balm. I like even chamomile. I use a lot of mimosa bark, and that one's really nice at just gently calming things.
Or
So
like valerian, like
valerian is
Pava
nice
mentioned,
too.
right?
Yep, and valerian you got to be careful with the dose because it can put you to sleep. So
It's too
again, that would be
calming.
a small part. Skullcap is a nice one. These are like mimosa and skullcap are mostly muscle relaxers, and valerian has, that's nervous system all the way. That's just like those are the nerves. Like if you've ever seen a valerian root, it's like it looks like neurons. It's just really cool. So those are my go-tos, I guess, as a laundry list of herbs for hypertension. But I also like in regards to just straight up heart health, I like grapeseed extract.
Right. You
That one
mentioned that.
has done wonders. I have a client who was on all the statins. He's on all these things that, he's one of these people that just has lots of he just gets plaques around the heart, and he's already had a heart attack. And they can't get him to stop making plaque. And I feel like he probably has a thyroid issue that they're not addressing. But I put him on grapeseed extract. He's on a blood thinner. He's doing it eyes wide open, and he's started to reduce his plaques. I mean, it's just like, wow, that's amazing.
Next thing you should do is have him get some iodine,
Yes,
right?
that's exactly it. They went to Florida. When they come back, we're going to talk about that. Grapeseed extract, and I also like it's called cardiac plus GF through standard process. And this is like B vitamins and some other things in there, and it just calms the heart. So I use that for hypertension. I use that for AFib.
Right.
So those are my lists just off the top of my head of the ones that I use for heart health. And I'm always suggesting, like, just chill out, reduce your stress,
Stress. Yeah.
guided meditations, exercise for sure,
Right.
and always, always, always get to the source. Manage
And
your
pick
insulin.
up a hobby. People don't say that enough. I feel like if your life is full of stress, you can find even 20 minutes to try to do something new that you might find calming, right? Or learning sometimes slows everything down in the body and the brain because you're learning something new, even taking an hour of the day to listen to our podcast, whatever it may be, just doing something that's not your typical go, go, go schedule, or something that's, ingrained in your whole week, doing something out of the ordinary, something new, something to calm your senses so that your brain can shut off, so your heart can calm down, et cetera, et cetera. I want to mention, because you did say a couple of times, not in a large quantity for certain plants and herbs. So I want to take a chance to mention to our listeners and our viewers who are physically looking, that if anybody wants to work with Hava or Sarah, you can reach them through phone, but you can look them up on their website, havawellness.com, HAVA wellness.com, and sarahsherbs.com. You can set up consultations with them. They can do phone consults if you're not in their area, so that you can describe a little bit about your situation so they can get proper dosaging and suggest certain dosages for you so that you're not taking too much of, let's say, valerian root because you're a little stressed out, but you don't want to fall asleep in the middle of the day, right? Obviously. So we want to be able to educate you in certain plants and their roles that they can have in your lives if you are going to implement them. But you do need a little bit more guidance, not just listening to our hour-long podcast. We want you to know these herbs and be able to recognize them when spoken to, if you ever want to suggest them to a friend or someone suggests it to you and you can recognize that herb, or if you're looking back to do some research, you can obviously research these herbs that have been mentioned today. But certain things you should know how to take them, right? So it's always great to reach out to our healers that we have here today, Sarah and Hava. Please set up consultations. Even if you want, like Sarah's mentioned, I have these blends that I make, and Hava's mentions, I have these blends that I make. A lot of these things are on their site. And so you can buy their products and the recommended dosages will be on their products. And if you need more explanation, you can chat with them about what you purchase from their website. So I highly recommend to make purchases from Our Ladies and support them, because not only do they give great advice, but they make awesome products. So I just had to get that out there. sarahsherbs.com and havawellness.com. Let's do a little closer because I know it lasts a good few minutes. Any last words about heart health before we stop recording and take
Yes.
questions from our live viewers? Yes, please, Hava.
Well, yes, I was just thinking while you've been speaking, and I thought, oh my gosh, how we forgot to speak about dental health, because dental health
Right,
is so much influence the heart health, and most people don't connect that.
right.
And Sarah is all the time mentioning and saying about inflammation, and most people don't understand that some of the main, I would say, this silent
Silent
problematic
killer, right.
yeah, that is a dental problem. And because as we know that our teeth as like a batteries to our body, and they are the ones who basically send the notifications, even though we don't feel that way. But in reality, this is what happens because they have all the nerves that go down. Actually, in the Old Testimony, they would check if the person is healthy if by asking how is his dental health. And up until this day, I think the many even animal doctors, how you say it, oh my god,
Veterinarians.
veterinarians, they look at the animal. I'm sorry, I have a bleep, it's okay. Veterinarians that look at the dental health of the animal, and
In
that way
order
we
to
can
determine the
understand in
health.
order to determine the health
Right.
of the animal. And that's the same thing comes to us. If our teeth are not healthy, our heart is not healthy.
Right. So
That's
when
how simple it
flossing, this
is.
is actually something that a smart dentist told me because he has taught me that the two are related. A lot of dentists won't tell you that, but if you're flossing, don't use those single flossers on a stick where the plaque that's in between and the dirt that's in between your teeth, you're putting back into your mouth, which can cause more heart health. You actually have to use a long string floss, and every tooth gets its own little segment of floss. Um,
That's
that's just
another
something
thing,
that
or
I was
just
taught
use a
by a
flosser.
great dentist.
But it is very
Right.
important to really look at your dental health, and that's
Right.
why it's so important to look at what are the materials they've been using, what are the if there is a silver amalgam inside that can cause so much inflammation in the body. And so that's another point that I wanted to mention. And I think that we forgot to mention about a couple herbs that also help to clean the blood, because we speak about the heart, but the red clover is very unique herb to help to clean
Right.
the blood. I found myself many times saying people drink some red clover because that will help to clean the blood and remove some sort of a plague. And that's another thing that I would suggest to the people. And as a final touch, I would add some minerals into your diet. And minerals are meaning a healthy salt. And most people are actually using a regular salt as their in their meals. And it's very important to switch to the healthier salts, because the salt that we are all junk snacks, they all contains this simple salt that actually can cause more trouble and bribes our heart from important minerals. Again, our blood from important minerals, right? So that's important to feed you with important minerals, and those minerals are in a Baja salt or any other good salts that are available to us. So get rid of the regular white salts, which bleached, and use a
Table
wholesome
salt. Right.
wholesome salt, so that way it
Sea
will
salts.
feed your heart. Yes, so that's very
Yeah.
important. And so yeah, minerals. And yeah, so that's what I wanted to add from my side. And
Sarah,
Carole.
closer. I loved it, Chava. I loved it. It was
Yeah, I
important
mean,
that we discuss those things.
yeah, that was
I,
great. Of course, that's all going to be very helpful to keep the blood healthy. I guess, as far as just some final words, um, try not to self-medicate. Work with an herbalist. Obviously, we're not going to poo-poo the doctors to death. I mean, there's something to be said about the diagnostics, but you don't have to take their drugs. So it's like work with your doctor, but then find somebody that can help you eke through. I mean, we were just like throwing solutions at you, and
Right.
and some of them are going to stick in there and some of them aren't. And if you're taking notes, it's great. You can always go back to the recording, but honestly, there are herbs that and formulations that can be formulated especially for you. So work with somebody. Just don't start taking Hawthorne, because it depends on what you're on for medications. You really have to be careful about mixing certain heart meds with certain heart herbs. So I would just caution people about that. Don't self-medicate. Work with people who understand what's going on. And especially an herbalist, because, I just had someone today tell me, well, I don't know if I should do all these things. I should check with my doctor. Luckily, their doctor's actually a naturopath who probably understand the contraindications in regards to meds and herbs. But most
Yeah,
doctors
but
do
most
not know.
doctors look at you like you're
They are
crazy.
looking in a computer database and going, well, you shouldn't mix St. John's wort with, it's like, okay, yeah, we all understand St. John's wort. And there are some, some meds and herbs that shouldn't be mixed. So herbalists know that stuff,
Right.
and at least they should.
Right.
And so work with somebody. Don't just try to do this by yourself, because that's why we're here. That's why we're doing this free for you. So you understand that there are people out there that know how to use the herbs and know what basic maladies are, especially with the heart, like we're talking today.
And our healers here go into an emotional level as well.
That's
Not only
right.
that, everybody is so individual. So your certain lifestyle is used to create these formulations for you, or dosages, so that we know, because everybody is so individual. I don't have time to drink 10 cups of tea a day because I'm always on the go and I don't have a kettle with me and whatever. So they will suggest an encapsulated form, or they can make it for you. So that's a great thing about working personally with an herbalist, especially Chava or Sarah, because they take your health personally. They want to see you succeed and they want to see you change your lifestyle. So we thank you all for listening. And as always, we're up for suggestions in the future. If you want to reach out to us on our Facebook, Heal Yourself Naturally, on our YouTube page, you can comment down here if you would like to have, if you have some suggestions for later on. Um, Discussions. If you haven't seen all of our podcasts, please go back and look at the other ones, so that we can, if there's anything we missed and anything else you'd like to hear about, we'd love to hear from you. Next On our next episode, we'll be talking about why am I so tired? It's a topic that everybody's always tired. Our life makes us
Right.
tired. Everything is making us extremely tired. We're going to talk to you about why you are so tired, what you can do to boost that energy that does not involve a shit ton of caffeine, a way to do it naturally. And yes, again, thank you all for listening to Heal Yourself Naturally. We will see you next time.
And
Goodbye.